Hey guys, it's Dr. Justin Marchegiani here. Today's video is going to be on functional medicine scams, how you can pick them out, what to look for. We're going to dive in. Before we do, put your comments down below. Let me know your experience and your thoughts on the topic. Smash that like button and give us a share to friends or family that could benefit. All right, so functional medicine scams. A little bit of a clickbaity title, but I get you watching this video. That's the most important thing. So the question I want you to look at, how do you know you're dealing with a practitioner or someone that could be maybe on the scammy side? Now, the first question I always want my patients and my future patients or listeners to think about, are we getting to the root cause? That's the first question, okay? Are we getting to the root cause? That's number one. Number two, are we making diet and lifestyle changes that are going to be rooted and long-lasting? That's number two. Number three, are we prioritizing nutrition over supplements? Not saying supplements are bad. Supplements are very, very important tools, but are we prioritizing nutrition and diet over supplements? Okay. And then the last one is, are we doing lab tests that are looking at and getting to the root cause and changing care? There's a lot of people that do testing, and those tests don't really change the care or don't really change the treatment of the program. They just kind of tell us things that we may already know, but they aren't really changing the overall plan. So let's start first. Anytime I'm dealing with a patient, I want to really highlight, hey, this is where I think the root underlying issue is. And this is how the plan that we're going to be doing is going to be addressing that. And so I always look at things from a physical, chemical, and emotional stress kind of foundation. Right? This is called the triangle or the triad of health. This is kind of like the foundation of chiropractic or functional medicine like D.D. Palmer or George Goodheart, right? The triangle of health is foundational. All stressors, for the most part, can fit into one of those three and or all three categories, right? Sometimes they overlap, and all three of those categories spill over, meaning if you have chronic pain, that's a physical stress, that chronic pain will create inflammation. That inflammation will eventually create chemical stress in the body. Cortisol can affect blood sugar, that can affect your hormones. Cortisol can then affect your mood and energy, right? And that can affect your emotions, right? So you see how a physical stress issue can then create a chemical issue and then can create a emotional issue, right? Because everything's connected. So we always want to look at the underlying stressors. Most people, there's going to be some kind of a food stressor, maybe a sleep stressor, maybe a too much or too little exercise stressor, maybe some toxicity, not eating good quality organic food, maybe nutritional deficiency, maybe toxicity from pesticides, maybe mold, maybe gut infections, parasites, poor digestion, gut permeability. There's a whole list of these different underlying stressors. So I always want to work with patients and say, let's look at the top 3 to 5 stressors that could be there. And most people, there's some kind of an overlap, right? There's poor diet, there's chronic gut inflammation, there's going to be some kind of food allergy issues, probably some nutrient deficiencies, maybe some exposure to chemicals or toxins in the environment, maybe some kind of digestion, immune, leaky gut permeability issue. There's usually 4 or 5 that are pretty common in between patients. Okay, so we always want to get to the root underlying issue. Now, next thing is, are we going to make dietary changes? Now, this is common. I see it more with a lot of medical doctors, people that haven't had a good foundation in nutrition. When they come over into the functional medicine, natural medicine world, you see them take out their prescription pad, a lot of hormones, a lot of supplements, and I'm like, well, what kind of diet changes have you made? Not too many, not too much. So I see a lot of conventional minded people that have made the path over to natural medicine, functional medicine, nutrition, and they aren't quite making a lot of root cause diet or lifestyle changes. That's one big thing to look at. Are we making diet and or lifestyle changes? That can be the diet. That could be avoiding certain foods that are food allergen issues. It could be also hydration, getting enough water and minerals. Are you getting enough sleep? Do you have your movement dialed in? Are you doing it, too much or too little movement? Is there some movement kind of dialed in? If I got a patient who's doing too much exercise and they're running marathons every day and we're not changing their diet and we're trying to give them some progesterone and adrenal support, well, you can see I'm not really fixing the underlying issue. So you really got to make sure you're getting to the root underlying issue. So we talked about diet and lifestyle. We talked about, having that be the foundation. We talked about let's go into lab testing. So are we doing labs that look deeper at the underlying physiology that's part of the problem? So I like doing hormone testing because hormones tend to be affected with chronic stress. Adrenals, they're part of your stress handling system. So chronic stress, your adrenals will be affected. So your ability to regulate and deal with inflammation, your ability to generate energy, have good mood, to be resilient to stress. Obviously, if you're a female, you're going to have PMS issues, mood issues that can obviously create other issues like breast tenderness, cramping, PMS stuff, fertility issues, fibroids, endometriosis, ovarian cyst. And then, of course, that can just transition into menopause and create a lot of menopausal issues, hot flashes, sleep issues, low libido, vaginal dryness, mood stuff, thinning hair, crepey skin. All those things tend to spiral out of control when there's hormonal issues. So I think looking at the hormones helps because, one, you're supporting healing, you're supporting stress resiliency. But if I'm not changing someone's diet, or I'm not getting them to bed earlier, or if I'm not improving hydration, you see how it's not really getting to the root underlying issue. So you really got to make sure, okay, if we're supporting this, let's make sure we're also supporting the other things. And so adrenal hormone testing is great. Gut testing is very helpful. Some practitioners don't do gut testing. Now, I mean, every now and then you get someone that comes in where you're like, oh, you got SIBO. That's fine. We'll just treat you for that. But then, you kind of have these natural instincts as a clinician. Oh, they probably have this. You kind of make a guess. And then when the labs come in, you kind of see if your guess is right. Every now and then you get, oh, now you got H. pylori. You have a parasite. You also have candida. And it's like, crap, I wouldn't have known that if I didn't do the deeper gut testing. Or, oh, you have occult blood. You have a lot of gut inflammation. So it's nice to know so you can, one, provide the root cause treatments and see if these things change, and also make sure infections improve over time. Sometimes you need a couple of rounds to knock them out, and it's like, man, you wouldn't know if you didn't test, right? So the testing does give you and the patient confidence, and also it helps you to know if you're dealing with infections, did you really knock it out? And looking at nutrient levels, whether it's a Nutri-Eval or a SpectraCell or an organic acid, some of those tests are wonderful. They can really give you some good root cause support that can be dialed in on the nutrient side. I like organic acids better because I love the idea of being able to look at the toxification pathways. I like to be able to look at gut bacteria and yeast in the urine because that gives me another window to see how the gut is doing. And I see every now and then I get patients that test really good on the gut test, and on the organic acid for dysbiosis and yeast, they're through the roof. And it's nice to have that little bit of extra support to know. And also neurotransmitters are big. The more people are chronically stressed, dopamine, serotonin play a major role in mood and hormones and feeling satisfied and sleep and just well-being and focus. And if we have issues there, then knowing where the amino acids are super helpful. Same with mitochondria, a lot of mitochondrial depletion. So knowing where B vitamins and CoQ10 and all of the Krebs cycle mitochondrial nutrients are at is super helpful. So kind of recapping, right? Are you getting to the root cause? Are you looking at the underlying stressors? Are you looking at the body systems, right? You want to make sure we're doing system support, underlying stress support versus symptom management. A little bit of symptom management's okay as long as you're still getting to the root underlying issue. Are we making good, healthy diet and lifestyle changes, right? Water, exercise, food, sleep, hydration. Are we using supplements but prioritizing food over supplements? Okay. And then the next thing I would say is, are we doing labs that look deeper at the root underlying cause versus just maybe doing things that aren't going to change care as much? So not saying that patients or doctors that do food allergy testing is bad. I'm just not a big fan of it because most of the foods that tend to come back are the foods that we typically remove on an elimination diet. And then there's a good chunk of time on food allergy testing that there's certain foods that the patient should be removing aren't there. And so if a test says, oh yeah, you can have gluten, and then you let the patient have gluten, well, they may still have a reaction that's not being tested on that food allergy test. So I'm not a big fan of it because I find there's more ways the body can react to a food than that food allergy test is testing, if that makes sense. And so I think you miss a lot of things with doing conventional food allergy tests. Other tests I would say, if you're just doing a lot of conventional blood work, that may be helpful. It may be good to rule people out. I'm not saying it's bad, but it may not change a lot of things that you're doing. There's tests that you may do to rule things out, but it may not change your care per se. Outside of that, other tests I'd say that may be helpful or may not, mold test or Lyme test. Some of these may be good things to look at. They may not be. It depends. I call mold and Lyme issues and co-infections the rabbit hole of functional medicine. It may be a root cause. It may not be. Usually the person's history tends to drive that. In what order I personally address that. I've seen a lot of patients that have mold issues. We address the other things and the mold becomes less of an issue. If they're in an active moldy home, that's a different story though. So I always like to prioritize things based on my, clinical experience of 10 plus years in the trenches dealing with patients. So in general, ask yourself those big things. What's the root cause? Are we making diet and lifestyle changes? Are we doing labs that look at the root cause? Are the labs changing the treatment of care? Are we fixing lifestyle as well? Those are kind of key things I want to put in the back of everyone's head there. And that way you can, pick up or, avoid the functional medicine scams, quote unquote, if you will. All right, I'm going to open it up for questions for y'all. If you guys want to reach out to myself and our colleagues, we'll put links down below. You can reach out to myself if you want to schedule a consult, available worldwide. And make sure you subscribe, thumbs up, and share to friends or family. Let's dive in. What's cooking here? Can untreated psychosis lead to dementia? So I guess it depends on how you define psychosis. Obviously, there's a whole bunch of symptoms that would be in the realm of psychosis. That's like obviously a mental health, psychiatric type of diagnosis, right? And so you're dealing with a patient that already has this kind of thing diagnosed, right? And so let me just kind of look at the definition here just so I can. So a severe mental disorder in which thoughts and emotions are so impaired that contact is lost with external reality. So it depends, right? I see a lot of patients who have very poor health, very poor diet, and we change simple foundational things and their mental health improves like unbelievably. And it's this kind of common sense, right? Your brain needs nutrients to run. Toxins and other stressors can affect your brain. So if you have stressors affecting your brain and you don't have the nutrients to run those pathways well, we can have a lot of major improvement in the mental health issue. So I think we can definitely help and support that area. All right. Now, could it lead to dementia? I'm not sure about that. I heard a PhD nurse say that overweight people need more vitamin D than normal weight people. Is that true? I mean, it would just depend. I mean, I just look at it as, hey, test your 25 hydroxy vitamin D3, see where your levels are at, make sure it's at least 50 to 70. And if it's not, just increase the dose there. Obviously vitamin D is fat soluble. If you're obese, you're going to have more fat. And so it's possible that some of that fat soluble vitamin gets absorbed by your fat. So it is possible that you may need more vitamin D, but just test to make sure that you're good with that. But how long do you think most lab testings are good for? 6 months to a year. It always depends. If someone has low thyroid and we're adjusting their thyroid support and what's happening, we're going to be testing monthly until we get their thyroid levels dialed in or their low iron dialed in. Some other testing on the hormone side may be every 6 months, depending on what's going on. So it's always good to look at the root underlying cause. And I would just say, with patients, compliance, everything. So how you manage a patient, how you work with them is important because you got to make sure they can make the changes. Just because you tell them, they can get overwhelmed. So you need to find little ways to baby step certain things if things don't work or if they're too overwhelming or if you have side effects, right? You need to be able to figure out, what's the plan B, C, D, E to address side effects or if patients get overwhelmed. And so you need someone that really can get to the bottom of kind of what's best for you. And everyone's a little bit different. You have this general path, but then, hey, maybe we need a little detour because that path is too hard for you. So we got to make sure we meet people where they're at so they get the highest level of compliance. My boyfriend does a meter on liquid paleo AIP diet where there's more food. He starts feeling bad and coughing outside of sticking to liquids / digestive. Is there anything else that we can do to help? I'm not sure what the question is. So I just hear coughing. I need a lot more information to be able to give you an answer on that. How do you fight brain inflammation caused by, we can't say that word, okay? But in regards to brain inflammation, the biggest thing that we're going to do that's going to be helpful, glutathione, very anti-inflammatory, curcumin and resveratrol are very, very anti-inflammatory in the brain. You can always do fasting, can be very helpful with brain inflammation. Progesterone can be very helpful with brain inflammation. So those would be some big things out of the gates from a natural anti-inflammatory standpoint. So we can't say that word, but that all those nutrients would apply for the thing that must not be named. All right, hope that helps you all there. Excellent. Let me see if I have any other questions here. So regarding chronic coughing, you'd have to look at potential gut issues, food allergy issues. You'd have to look at chronic post-nasal drip with maybe some kind of bacteria or fungal stuff up the sinus issues. And you may want to look at mold as well. And of course, NAC can be wonderful. Sinus flushing can be good. And maybe even some nebulized glutathione can be helpful as well. I'm on warfarin, which is AKA rat poisoning, FYI. I was wondering if I take iodine, would that be dangerous fasting raise my INR. So INR is like your international ratio. It's basically looking at clotting factors, right? So the problem with conventional medicine and warfarin is, they'll say, let's say you have a certain amount of green vegetables in a day. That is vitamin K. Vitamin K increases clotting. So a lot of times they'll want to keep that stable or even keep those nutrients down. I'm not a big fan of that. So I recommend have a very robust diet that has a lot of the nutrients you need to be healthy, and have them run your INR based off of that, and then dose your rat poisoning or warfarin off of that. Now, I always say dial in all of the natural blood thinners first, right? And then if you need a pharmaceutical blood thinner, then maybe your dose will be lower, okay? So things like ginger, things like systemic enzymes like serrapeptidase taken away from food, things like ginkgo and fish oil, and of course an anti-inflammatory diet, anti-inflammatory nutrients like curcumin, all are amazing and will help decrease platelet aggregation, decrease clotting. And so if you need a medication, then it'll be less. So always have a really healthy diet, get your insulin levels low, get everything dialed in, and that will help a lot. Are there multiple root causes for adrenal insufficiency? Yeah, so like conventional medicine with Addison's disease, that's usually going to be autoimmune. So, and then what causes autoimmune is like the next question, right? It's a question of a question. And that would be gut permeability issues, gluten, dairy, other stressors in the environment, poor nutrition. All of those things can drive that. So you got to get to the underlying issue. And of course, any type of mental, emotional stress, any type of physical stress, any type of emotional stress unchecked can definitely affect your adrenals, which then affect energy and mood and stress resiliency and sleep and everything. Okay, thyroid nodule. Yeah, so thyroid nodule a lot of times can be a lack of iodine. It can also be autoimmunity, and too much iodine can also cause autoimmunity. So you got to be careful. So I always recommend get diet and get general nutrients dialed in outside of any iodine over, let's say, a milligram. If you're going to use iodine, keep it at a couple hundred micrograms as long as antibodies are stable, and selenium and zinc and CoQ10 and fish oil and all a good quality multi and good quality anti-inflammatory nutrients are in the background. Hip flexors seem to be compensating for other muscles and therefore getting painful during squats, single leg deadlifts. Which muscles should be weak? So, I mean, during a squat, you're going to be doing a lot more hip extensors, right? And so your hip extensors are going to be your glutes and your hamstrings. So it shouldn't be compensating because hip flexors are a flexor. When you're doing a squat, you're going into extension, right? So it shouldn't be overly compensating. More times than not, it's your hamstrings compensating for your glutes. And so seeing a good applied kinesiologist chiropractor that can work on that can be helpful. A lot of times tight hip flexors, you need some ART or myofascial release to kind of help relax the hip flexors, and that can allow everything else to work better. Can long-term NAC be used? Could hurt your liver? No, I mean, it's an amino acid. It's a precursor for glutathione. They actually find things like Tylenol actually decrease glutathione. And so I think NAC is safe. It's an amino acid, and it's in food too. I have high homocysteine and suffer from folliculitis, IBS, anxiety. Probiotics and fermented food make me worse. Is it a mast cell disorder and high histamine issue? So mast cell and high histamine, that's in effect not a cause, right? The more your immune system is stressed, the more inflamed you are, the more gut permeability you have, the more basophils and histamine may occur downstream. So you got to look upstream. And of course, if those foods make you feel worse, probiotics, fermented food, there's probably a lot of SIBO and bacterial overgrowth and maybe inadequate digestion. You got to look at everything else. Which one of your GI Clear lines is for mold or candida? So candida primarily, GI Clear 5 is still for candida because it's oil of oregano. 6 does have some Podiarco in there, so it's still really good for candida. And 3 can be helpful, which is a pure silver. Silver is great for candida, but typically 5 would be kind of my first, and then 6 or 3 would be second. Thank you for all you do. I suggest your videos. Oh, I know. Thank you so much. Really appreciate it. Is keto good for thyroid? Now, it depends, right? You're going to get both sides of this issue. Now, the reason why you get both sides, because they're both right. The problem is the one that's right over here doesn't acknowledge the other reason why they could be wrong or right. So the reason why keto would be good is because a lot of thyroid conversion can be affected through insulin resistance. If you have a lot of insulin resistance, that can affect thyroid conversion. Well, guess what? Are most people overweight and having insulin resistance in this country? Yeah, most are. So yeah, if you get your carbs down and you help your insulin levels drop, will that help thyroid conversion? Yes, it will. So that's why it would help you. Now, if you already have a decent weight and you already are feeling pretty decent, but you have thyroid issues, would going too low carb for you maybe affect your thyroid? Yeah, because we need some level of insulin to help with thyroid conversion. So if your levels are too low, that may cause problems. So you see how both sides could be right. Now, I would say in general, if you flip a coin, you're going to be, if you're going to just flip a coin and make suggestions, right? Just recommending keto will help more people than not, just because more people have insulin resistance. I've noticed lately that taking a lot of magnesium in many different forms has greatly helped my mood and cognitive process, even with a pretty solid paleo template. Just wanted to mention this. Yeah, magnesium has over 300 enzymatic roles in the body. It helps with energy, Krebs cycle, mitochondria, relaxation, bowel motility, neurotransmitters. It helps with so many things. So yeah, like low-hanging fruit, good clean magnesium in your diet can make a huge difference, right? Huge. And I think the CDC's even said like half the population is deficient in magnesium. It's crazy. Half the population. So yeah, I totally agree. Getting that under control can be helpful. Now, just doing that's usually not enough, but it's a good first step. Right? We call that the low-hanging fruit of functional medicine. All right, cool. All right, guys, hope you enjoyed today's video. If you did, put your comments down below. Let me know one thing you learned. Really appreciate it. Share with family and friends. Give me a thumbs up. Really helps. Can aspergillus disseminate into the joints? Like aspergillus, like mold stuff? I've definitely seen mold create joint pain. I see one of the major side effects or improvements of addressing mold can be improvement in inflammation in the body. So yeah, it's definitely possible. Does it mean that everyone who has aspergillus has mold issue, or everyone who has joint pain has aspergillus? No, not necessarily, but it's something that you can look at. And a good oat test, organic acid test, or a good urinary mold test could help figure that out too. All right, guys, hope you enjoyed today's video. Really appreciate it. You guys have a phenomenal day. I'll be back tomorrow. Peace, y'all. Bye. Take care, Facebook.